feel like I skipped this in the beginning. First of all, when should we go to a dermatologist? When should we go to an esthetician? I think it's important for people to understand
And the difference.
Yeah.
Yeah.
So the floor is yours.
I think I can go first.
Yeah.
Okay.
That's a really good question.
Yeah.
Actually, a very big pain point of mine, I have to say.
Mm-hmm.
Okay, first let me distinguish. I feel like currently, and even when I started, there's kind of two camps of dermas,
Hi, guys. Welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough health information to enable you to make an informed decision about your health. So, in the past, I've had one guest, but today I have two, and I'm so excited for you to meet them. So, I'll introduce them briefly, but then I'll give them the opportunity to introduce themselves as well. So, I have Yvonne Kani, and I'm sure you know Yvonne. If you're on Instagram, if you live under a rock, you might not know her. But if you're on Instagram, you know Yvonne Kani. She's an esthetician, and she teaches us everything about skin. Then I have Dr. Njeri. She is a dermatologist, and she is, our health expert in the room today. So I'll just let them introduce themselves and then we'll move on.
Okay. Hi everyone. My name is Yvonne Kani. I am a licensed esthetician, lover of skin, and I'm really, really big on educating people about how to take care of their skin, because in 10 years I'll sell my business and go live under a rock, and I won't be here to tell you what to do with your skin. So I want for you to be empowered with that information to guide your purchases and just how you take care of your skin throughout.
I will plug your business.
Oh yeah, my business is Beauty Square KE, where we offer skincare solutions through products, but also we guide you through this journey of knowing what exactly to use for your skin that is actually going to help with your skin health. We're very big on skin health and not necessarily the cosmetic benefits. We all want glowing skin, but healthy skin is actually the goal. Yes. But we also offer facial treatments. Hopefully by the time this podcast goes up, we'll have opened our new space. We'll be offering even more skin treatments. So yeah, I think Hope will plug you guys in the caption.
I'll put all your tags. If it's Twitter, Instagram, everything, I'll put them all here. So next, Dr. Njeri.
Hi everyone, I'm Dr. Njeri Njoroge. I'm a consultant dermatologist and I'm happy to be here to dispense what I know about skin health and also learn. Yeah, thank you for having me.
First of all, let me clap for yourselves. You know, you're all professionals. Like the other day, I just watched this video and they were talking about, do you know you're literally living what you wanted to be? Like when you're growing up, I wanted to be a doctor and you're actually a doctor now. Did you want to be an esthetician?
No.
What did you want to be? What did you want to be?
At some point, I wanted to be a doctor. But then med school freaked me out, still freaks me out. I wanted to go into marketing.
Oh.
Yeah.
I think you'd have done such a good job. Yeah.
But yeah.
Oh. What about you?
I've always been a geek. I knew I wanted to be a doctor from the get-go. Grey's Anatomy, ER. I was sold the dream and I fell for it. Derma, it's kind of a personal journey because I got acne in my 5th year of med school. And I think there were very few dermas. So I saw one. I wasn't really content with the management. But just seeing the queue in his office piqued my interest. Then I wanted a work-life balance, a semblance of that. So derma is among the few specialties where you can have that. Yeah, I stuck to that and here I am.
Oh, nice. So I usually have a segment. So there'll be 2 segments. So the first one is a journey through Inside Out or to Inside Out. I don't know if you guys have watched Inside Out, the movie. You haven't?
No.
Okay, fine. Let me brief you. So it's basically a movie that explains the emotions that we experience as human beings and why we act the way we act. So a journey to Inside Out is where I just get to understand where are you emotionally right now. Yeah. So that's that.
It's a heavy question. I'd say today, I guess the emotions I'm experiencing are, I guess a bit of like fulfillment, like doing things like this, and also a bit of is fatigue and emotion.
We'll make it an emotion for you today.
My son is teething, and I didn't realize how tough of a season it is. It really is. But other than that, I'm feeling really great. Like what you're saying, like we're living the dream that maybe not when I was young, but 5 years ago that I was really hoping for. So yeah, it's good.
What about you, Dr. Njeri?
Mine is similar, contentment. I just graduated. I hit the ground running. I'm working. Like I'm just thankful to God for the opportunities. that came because December needs money and
It
I'm
does.
grateful.
December, we are outside, by the
Yeah,
way.
we are
And money
outside.
for skincare.
Yeah. Most importantly, yeah.
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 Oh, by the way, we're shooting this in December. It'll come out in January, but we are still enjoying the December madness.
yes.
Yeah. We should have gotten for you Mshaino
Oh,
for
yeah.
your graduation. And maybe like the cup. Okay. Then I usually do this thing where I want us to, we're here to educate, Sinjo. So I want us to decipher some medical jargon. You mentioned something, you mentioned hyperpigmentation. So I think that's the one thing I'll let you decipher. And then you can pick something in Dharma that people keep asking about or you feel is not really spoken about that people should know. Just like a medical term.
Okay.
Yeah.
Okay, so hyperpigmentation, I like for people to think of skincare as logical because it is logical. So like the word hyper, for example, means too much, right? Like hypertension or hyperactive. So it means too much, and pigmentation just means color. So hyperpigmentation just means too much color, but technically it refers to when there's more pigment in a certain area than is normal. I like to use that word specifically because as people of color, we're not one shade from head to toe.
Yeah.
So like your knuckles may be a bit darker. That's not necessarily hyperpigmentation or your forehead. So yeah, that's hyperpigmentation. If you have a dark spot or you got a cut and now it's a bit darker, that is hyperpigmentation.
Has it ever told you you could be a good teacher? You really could.
I will open a school.
I think it helps that she's not a medic because a medic could
That's
have used
true.
medical jargon.
Yeah, that's actually-
So you've gotten to understand things as a layman.
Yeah. Now to you because you're the medic. Let's
so
see how you
me-
do.
I'll choose eczema because it annoys me because it's such a broad term. Eczema just means dermatitis.
Yeah.
So atopic eczema, like what babies usually get,
Yeah.
is not. It's atopic dermatitis. Don't just say eczema because eczema is such a broad term. You can have hand eczema from like what are we using sanitizers and all that. So there are different eczemas. Yeah. So
Do you want to elaborate
Eczema is
what a topic? You know, you brought in a topic now.
atopic dermatitis. Well, it's to simplify it, it's just a type of skin allergy. Yeah.
Okay.
Yeah. So those two rashes babies come with,
Yeah.
and La Roche products are pushed there. But they work.
They do work,
So
yeah.
yeah.
And the allergen can be either topical or
Yeah, it can be
ingested.
environmental. It's a mixture of genetics and environmental things.
That was an MCQ in med school, actually. Different types of allergens. Yeah. Okay, so why I have you guys here today, and I think you've alluded to that point, Kidogo, is today we have a lot of consumerism when it comes to skincare. And I think people have this notion that consumerism is just how much money you're spending on the skincare product. But I want people to understand that it's not about the money, it's about, is this product right for you? Or are you just getting this product because you had it here, someone told you need this product, but is it fitting your needs, your skincare needs? So I was having a discussion yesterday with the lovely production team, and one of them mentioned they saw a tweet where someone was mentioning she just did her skincare restock and she spent like 19,000, and then someone responded, 19,000 consumerism itawamaliza, me I spent 3,000. So I just want to hear your thoughts. Do you think there's consumerism today in skincare?
Okay, I think one, yes, to an
Okay.
extent. But that tweet, I think people need to understand everyone has the things they prioritize, right? Like there's someone who spends $1 million bob in insurance.
Yeah.
To someone else, that's ridiculous. To them, that's important, right? The same way to her, 19,000 is important for her in terms of skincare. For this person, maybe it's not a priority. That's why they don't spend as much money. And the same maybe with someone has 30 cars because they like cars and they spend their money on that. But there is I don't want to put it that quality products are expensive, but a lot of the good quality brands we have currently tend to have a bit of a bigger price cap, and 19 is actually not a lot, guys.
You, how much are you spending? How much is your restock?
It lasts for 6 months.
Yeah, let me explain.
Yeah,
Maybe
that's
some
what
of the
it is.
products you got are really big sizes. So,
Yeah.
for example, your La Roche and CeraVe are like 400, 500 ml. That can last you up to a year for a user. So someone has not even thought about how long will these products last them. Then maybe they bought skincare and body care. Maybe they also bought deos in there. They also bought a body lotion, a body soap, all of that. But I think, especially in the era of skin talk, people are buying products because TikTok said so. You'll find someone is buying, let me pick the one that's really trending right now, the Annual Dark Spot Serum. this person has no hyperpigmentation, none. Maybe their problem is aging.
Yeah.
But because TikTok has said this is the serum, that is what they then go and buy. People don't stop and ask themselves, do I actually need this product? The same way that you just put it. We don't apply logic to our skincare purchases. And I think part of it is because the beauty industry has been made to feel like that. Like it's supposed to be abstract and difficult to understand. So then you just buy whatever you're recommended. Then you rely on vendors like us to tell you what to use. But I could be lying to you.
That's
okay,
true.
I'm not. But I could. But you as a consumer need to be able to decipher if what I'm telling you is accurate or not accurate. Yeah.
And now, because you've said that, first of all, skincare has it's a $1 billion industry.
Yeah.
Do you think they have the responsibility to educate people on the products that they're selling?
I want to say yes and no.
Okay.
Because as a consumer, it's also your responsibility to educate yourself. For example, if you're going to buy a car, right? You can't say it's now Range Rover's job and Mercedes and whatever to teach you how to buy a car. It's also part of your job as a consumer to know what kind of car should I buy based on my budget, what specs am I looking for. So I think also as a consumer we need to take that into our hands and educate ourselves. But I think because the beauty industry is so big and it really focuses on something so vulnerable for people, we need to be more open and honest with our communication and try to break down the barrier so it doesn't feel so difficult and people understand what you should use and for what. And I think some of the brands now are really trying to do that. Yeah.
And what about, because now from a medical perspective, because I think the skincare industry is so broad, there's what I would say aesthetic medicine, and then there's now like curative medicine, where there are people who actually have conditions that need to be treated. So would you say that now some of the brands have products that manage these conditions? For them, is it their responsibility to educate, or are we as healthcare providers not doing enough to educate our patients on these products and how to manage their conditions?
Yeah. So there's a term, cosmeceuticals.
Where?
So you can already tell. You can already tell it's two in one: cosmetics and pharmaceuticals.
Yeah.
So I think since that term came up, there's been a gray area. Like regulatory bodies like the FDA have tried to regulate sunscreens, and even, but I don't know, it's just not working.
Yeah.
So I think I take it on myself as a medic, someone who will understand that language, to read on these things and educate. But yes, I think it's also the responsibility of the brand to be as transparent as possible. If there's not enough clinical evidence, they've not done enough studies with their product, they should just be open enough to say that. Yeah, that disclaimer. So yes, I think they shouldn't just be let off the hook, because it's a $1 billion industry.
It is. Just like Big Pharma. Like,
Yeah.
And I like the fact that you brought about like glass skin. How do you feel about some of these buzzwords that we're seeing now? There's a lot of anti-aging in products. There's a glass skin. There's, what else have we seen? Radiant skin. Like, what do we think about that? Do we think it's deceiving, or
I think
what are your
it's
thoughts?
definitely like a marketing gimmick, especially when it comes from like brand as brand messaging. I really, really dislike. Oh, I'm really going in the deep end now.
Speak your mind.
Politically correct. I dislike when brands use like a certain claim, marketing claim, like to really shout about their product. Like, this will remove your freckles in 2 weeks, right? I don't like that, because you're giving people a promise that you can't guarantee that for everyone. And especially given such a short time frame, you give this thing of kind of like popcorn results. It can't happen that quickly. But as I said, my focus normally is on healthy skin. I try to educate my clients the same way. Focus on healthy skin. I know the acne is very debilitating and it makes you upset. You don't like how you look. But if you focus on healthy skin, one day you'll just wake up and be like, hiya, the acne went. And even the dark spots are fading. So focus on your skin being healthy. All these other things kind of come as a like by the way.
That's true. I feel like I skipped this in the beginning. First of all, when should we go to a dermatologist? When should we go to an aesthetician? I think it's important for people to understand
And the difference.
Yeah. So the floor is yours.
I think I can go first.
Yeah.
Okay.
That's a really good question.
Yeah.
And actually a very big pain point of mine, I have to say. Okay, first let me distinguish. I feel like currently, and even when I started, there's kind of two camps of dermas, right? There's a camp that's very skincare aware, and by care I mean like the day-to-day caring of your skin, like knowing you
The
should use a
holistic
cleanser,
thing.
you
Yeah.
should use a sunscreen. Then we have those who are
Medical.
conscious of that and those who are not,
Okay.
who are more medical focused. Exactly. They know their treatments for acne and hyperpigmentation. So when you come with acne, they'll give you benzoyl peroxide, tretinoin, use one in the morning, one at night, every day for 3 months, damage the hell out of your moisture barrier, and they don't even know how you're going to repair it, and that's that. So my issue was a lot of people were going to this second camp, those who didn't know a lot about skincare, and unfortunately sometimes when it comes to healthcare or areas where we feel like it's a very like high barrier to entry in terms of knowledge, we just trust that person.
That's
We don't ask questions, we don't do our own research. So when a derma tells you to do that, you don't go and think, okay, which maybe I should also use a moisturizer, sunscreen, and cleanser, or just do some research and see what are other people saying to do. Or now if they come to me and I tell them something different, my opinion is disqualified because I'm not a medical professional, right? Even though this is my area of expertise. So I think certain cosmetic issues, like if you're just starting a skincare routine, I don't think you need to consider a dermatologist. I think step number one is sit down at your computer, use Google, and do some research first.
Yes.
So that whenever you go somewhere and you're being told nonsense, you will get a sense this is nonsense. Secondly, things like maybe acne, hyperpigmentation that are not severe and maybe not stubborn. Like first give it a try of trying to fix it with products, maybe for about 6 months. Then normally with my acne clients, if it's been about 6 months and acne is still really stubborn and it's the higher grades of acne, like very intense, then I will refer you to a dermatologist. But I like to also educate them, not to be discernful about getting advice from a dermatologist and knowing, just thinking about also the care of their skin. And I like to make it clear that it's not that I've handed you over to them like, okay, go. Ideally it's supposed to
Collaborate.
be it's synergistic, and especially if it's hormonal, then I also like to loop in your gynecologist because then you also have to deal with your hormones, because the skin doesn't exist on its own. It's part of the system that's your whole body. So I'd say go for derma when you're having certain cosmetic topical concerns that are stubborn and are not kind of going away, especially if it's hormonal related. And then now obviously if you think it's a skin condition, like any kind of disease or conditions, please go and see a dermatologist. But we're making you money, but if you just need a skincare routine, guys, come on.
I agree.
So I had mentioned fifth year I got acne,
Yes.
went to this derma, and I agree with what she said because
First of all, can I interrupt you kidogo there? How was it getting acne as an adult?
I think I was just like your typical African, like it'll go. I didn't hit it for like 4 months. I was like, it's just stress or whatever. But then the dark spots were what were like really disturbing me. Yeah, so finally I just started to see one. But if you're asking if it bugged me mentally, I don't think so. My sister was always like, you're still pretty. You're still, I think you actually need people to to affirm you, like beyond the skin, you're more than that. So I went to this derma and he only gave me retinoid for usiku. Didn't tell me anything about how it increases your sun sensitivity. And I really, really burned. So that's why I never went back. So I agree. I think, but these days, I think we're taking it up as a challenge to be wary of like both sides. You can't just be medical alone.
That's true.
So what were we answering?
When should you go to a derma?
When you should go to a derma. I'll say when I like referring people to estheticians when I think they need a procedure.
Okay.
Because now I'm still doing clinical derma. So I think I can sort them now, like aesthetically and the clinical
Medically,
aspect. But if it's something like chemical peels or removing skin tags, because I don't have the equipment right now, that's when I refer my patient. So otherwise, as a derma, I feel comfortable seeing anyone. But when it's serious, when you've been on medication, it's not working, even when you want to talk to someone, because skin, mental health really connected. So some people just need that assurance from a medic. I think it helps a bit more.
That's true. And I like the fact that you said skin and mental health. Because there's this thing that has been going around where people look at acne and they say that's not normal skin. Like, it's normal skin. Your skin is okay, it's healthy, you just have something called acne that you can work on. And I think for me, even as a teenager, because I got acne as a teenager, it was, Form 1, wow, radiant, glowing skin. And then Form 2, I don't even know where those bumps came from. And from there, it's like you just sink.
Yeah.
Because you're just like, what are these on my skin? And it's like, everyone was just like, that's not normal skin. You have to get it fixed. But it's not coming from an empowerment perspective where
Yeah.
you're just like, your skin is okay. But I think you can,
can do
just,
something.
do something if you want to get rid of those spots. So I like the fact that you've combined the two.
Yeah.
Then you mentioned procedures. Are there procedures that you're comfortable doing as an esthetician and that you're comfortable doing as a dermatologist? Maybe not now, but through your practice and your
Yeah.
training.
Yeah.
And like, where do we draw the line? Because I think now we are seeing it's like the lines are blurred where people are doing. Yeah, so like, where do we draw the line? When is it an esthetician's place? When is it a dermatologist's place for certain procedures?
I personally don't think there's like she said, collaborative.
Yeah.
Because in Dharma, I learned everything. We had a laser machine, phototherapy,
Yeah.
biopsies, like if you have a lesion and you want to know what is it cancerous. We did microneedling, we also did it. So
Really?
yeah, for me, I don't
wow.
think I'm limited really.
Okay.
Yeah, so I would work with an esthetician.
Yeah.
Yeah, so maybe if I'm to start a clinic, I would see the clinical patients, they do the procedures.
Yeah.
And people actually do that. They train other people.
I think that's a good collaborative
Yeah, it is.
approach. Yeah.
It's a good balance.
Yes.
Yeah, you're
What about
helping
in your
all types.
training?
Let me answer from so from my training, I trained in the US, and there are these very strict lines of like, this is where you are, this is where you're not. So the estheticians normally only allowed to work on the epidermis, which is now the top layer of the skin.
Yeah.
Then for you to work on the dermis, you have to be a medical professional. So you could be an aesthetic nurse, you could be now like a dermatologist, but also now that dermatologist can train people in their clinic. So I can do it as an esthetician, but I have to be under a dermatologist, meaning there has to be someone in the clinic who is a medical professional in case of anything. So those are the ones who are not allowed to go into the dermis. So those are things like microneedling to a certain depth, chemical peels of a certain strength, anything that goes into the body, like injectables, even injecting IV, technically that should be a medical professional. So those are kind of the lines. Our regulations are honestly kind of blurry, and I feel like a tad outdated. But the thing that should be the guideline for me, like how far in are we going into the skin? And then sometimes it's not that I need to be like a doctor or a derma, but working under one or under the supervision of a derma. So I'm actually currently in training to become a medical esthetician. Yes, thank you. So now I'm training under a dermatologist on how to do all these treatments. But even if I was to start doing them in my treatment, I would still need to be working under a derma.
Okay. Okay. Is there regulation in Kenya?
Sort of.
There is.
Yeah,
Sort
sort
of.
of.
Okay. Okay. You'll be the one to formulate it.
Sort of. It's not very up to date with where we are currently in the industry.
Yeah.
Because technically they're only recognizing now like dermatologists to do such treatments, or now
Plastic
working
surgeon.
under a or a plastic surgeon. But there's certain things like if I'm only microneedling up to like 0.25, like I'm not even touching the dermis. That technically should be in the field of an esthetician. And they've not really defined that, like estheticians and what they're allowed to do. Yeah.
How is it coming from training in the US to working in Kenya?
I think it was interesting also because I had quite a gap. So I came back in 2021. I started practicing, I think, in 2023. Yeah, 2023.
Oh, that recently.
Yeah.
But I feel like I've been seeing you on my Instagram for the past 5 years.
Yeah, so I've been creating skincare content for that long, yes.
Okay.
But I went to aesthetic school in 2020. I graduated in 2021, and then I started practicing like 2 years later. Partially because of fear, but also when there's that of moving back,
Yeah.
configuring the business. And
You've
all
done
of
it so well.
Thank you. Yeah. So
Okay.
it was an interesting transition from an area with these very strict guidelines to here, but I also feel like here there's not a lot of places.
Yeah.
So it's just a bit harder.
Okay.
Yeah.
Okay. But you've kind of found your balance.
Yeah.
Okay, which is good. You mentioned plastic surgeons, dermatologists.
Yeah, now there.
Please tell me, how do they work together?
I feel like plastic surgeons, because actually one wanted to collaborate with me, but again, they're coming to me for the clinical aspect. Then they can do the Botox, the fillers, the microneedling. They still do the same thing. Yeah, so I feel like for plastics and derma, there's no clear cut.
line.
Yeah.
Me from watching Grey's Anatomy, I thought plastic surgeons do things like facelift.
They do, but I
do,
think these
like a
small
skin
procedures bring in money
transplant.
quickly. Okay, I'm
Yeah.
not saying.
No, it's true. They
Yeah,
do.
they bring in
They
money
do.
very quickly.
Oh,
And it's a small thing, walk in, walk out. Yeah, they do.
And also, it's because they're identified as cosmetic
Yes,
procedures, which is
yes.
what they've been doing in the past. Yeah. Oh, That's interesting.
Yeah.
Now, you talked about healthy skin. I want you guys to define healthy skin. Yeah. What is healthy skin?
Interesting. What is healthy skin? I would say healthy skin, first of all, you can kind of like identify it from looking at it. So healthy skin normally will be, I'd say, one, well hydrated. So well hydrated. Also based on like the texture and the presentation of the skin, you can kind of tell it's healthy. But I think an easy way to put it is skin that's well taken care of. Like if you do at least your basics, the cleanser, moisturizer, sunscreen, consistently, you're gonna have healthy skin.
Okay.
Yeah, and then address, like you have dehydration or things like that, address that.
Okay.
Yeah.
Okay. I have a question, but I'll get back to you.
For me, I'll use medical terms. So
Okay.
to me, it's where the epidermal or the skin barrier is intact.
Okay. Okay.
Yes.
So I think you've given two different perspectives.
Yeah.
And my question is based on that. So would you be able to identify healthy skin by just looking at it, or comprehensively you'd have to ask a few questions and probe a bit more to find out if that's healthy skin?
I feel like I can get a pretty good idea by looking at your skin if it's healthy. But especially like when you're coming for a treatment and we do the first cleanse, I can usually pretty tell if your barrier is damaged. Sometimes you can have an indication, or like dehydration normally is a good indicator of that. But sometimes it can take a bit of probing because someone can have like kind of glowing skin, maybe from the products they're using, but their barrier is damaged.
Exactly.
Yeah.
There's such cases where it can be a bit difficult to tell, but once you explain certain symptoms, I can be able to know, okay, you probably have a damaged moisture barrier.
Yeah, interesting. Now you can just look at skin and be like, maybe not healthy, not healthy. That, and first of all, I didn't even mention none of them is wearing makeup, and their skins are glowing. Like, wow, my aspiration. I aspire to be like you.
Also glowing.
I'm wearing makeup. But thanks. Okay, then I had another question. In terms of now, let's say someone is starting off their skincare journey. What would you advise in terms of products? Like, where do they start? Yeah.
As I said, start with your own research.
Okay.
First, number one. And obviously research from like accredited sources or people who have like an inclination of what they're saying.
Give us those accredited sources.
TikTok is not
Accredited.
yeah, I don't know how to put like an authoritative source. Let me say that. So do some research on what is like considered. How do I start my skincare routine? There's like doctors who have blogs, or estheticians who have blogs. Those are good places to start, and then now come and maybe talk to an esthetician. Or if you really feel like I want a derma's guidance, then sure, go ahead. And then ask for, okay, what should I start with? Don't buy anything. And then go and double check what they have said. And then I'll come and buy products. But so you'll probably be told cleanser, moisturizer, and sunscreen. Yes. But look up the reviews of whatever you're being recommended. So that even when you're using this product, it's not just based on Yvonne Aliniambia. Yeah, you have an idea of, okay, Hope used this is how it went.
Yeah.
Jerry used it, this is how it went.
Yeah.
So also you have an idea of maybe what your experience might be like. I think a big pain point sometimes for clients is reactions.
Yeah.
And people don't understand that reactions can happen.
Yeah.
Just
They
the
call
same
it
way-
purging. Is it purging?
No, there's
Purging
a
is different.
yeah.
Okay.
Yeah.
You'll have to explain purging now later.
So briefly, purging is maybe when you use something that increases cellular turnover, and so that it makes like your breakout surface faster.
Okay.
And those will usually only be actives, things like salicylic acid or retinoid or benzoyl peroxide.
You see why you're here?
Yeah.
So like a moisturizer that doesn't have actives should not give you purging.
Yeah.
That is probably a reaction, and a reaction sometimes will come in the form of now like atopic dermatitis or dermatitis, like a rash or redness or even sometimes breakouts. But those can happen the same way. If you give me medication, my body can react to
Yes.
it, right?
Yeah.
And sometimes there's no way of us knowing ahead of time. Sometimes it takes that experience of we've tried ABCD. These are common ingredients. Okay, maybe your skin has a problem with these ingredients. So sometimes people interpret a reaction as you gave me bad products.
Yeah.
But it's just that your skin didn't like the product. So if
Yeah.
you took some time to understand what is other people's experience of it, it'll give you an idea, okay, this might not work, and that's
Yeah.
okay. And if it doesn't work, I can come back and say, hey, I tried this, it didn't work. Let's try something else.
Okay. Okay. Now, Dr. Njeri, so many of us are, I think we've been hearing a lot, especially this year, about acne. And I just wanted us to touch on acne. First of
Yeah.
all, what is acne? Give us the medical perspective, because it is a health condition.
Yeah, it is.
Yeah.
So they define it as a chronic, and I want to
Thank
highlight
you.
chronic
Yes.
because people look for a quick fix,
Thank
and
you.
no, it's a journey. So it's a chronic inflammatory condition of the pilosebaceous unit.
Hey.
Pilo is hair, sebaceous is the sebaceous gland. So usually our skin has hair all over.
Yeah.
So that pilosebaceous unit is what is the main problem. Yeah. So I think there are 3 to 4 factors that are in the pathogenesis of acne. So one is there's a bacteria that we all have on our skin. It's
Yeah.
called Cutibacterium acnes. Then followed by inflammation, so it triggers inflammation. Then you have follicular hyperkeratosis, meaning that the cells in that unit are not differentiating and exfoliating as quickly, so they get clogged up in that unit. Yeah, then there's increased sebum production. So those 4 things are the pathogenesis. Yeah.
How acne comes
Yes.
about. And is it true? Okay, I have oily skin, extremely oily skin, and my whole life I think I've always known that oily skin is acne prone
Yeah,
skin.
yeah.
Is that the case?
No, because I've also seen people with dry skin getting acne. So that's why it's
Yeah.
important to know that all those 4 factors, plus genetics as well,
Yeah.
and stress and all that. Yeah. So I said increased sebum, but you can also have the bacteria,
Yeah.
the follicular hyperkeratosis. Yeah. So all those interplay to cause it. So yeah, any skin type can
And
get
can
it.
you cure acne? Thank you. Just say it loud. Yeah. Because people have this
That's
notion
from-
that you can cure.
Can manage it.
Thank
Yeah,
you. Because it's a
can
chronic
manage it.
condition.
It's a chronic condition.
Yeah.
Yeah.
So that quick fix will never.
Yeah.
It's most of the time it never happens. So it is a product that's promising you that in 2 weeks
Instant
you won't have your
results,
acne.
yeah.
Think twice. Think
Can I
twice.
add something?
Yeah, sure.
I feel like sometimes consumers treat skincare like medicine. Like take 3 times a day for 3 weeks.
Like a headache and
then
it's
you're
Yeah.
done. But
Yeah.
that's not skincare. Like you shower every day, put lotion every day. Why do you only want to cleanse your face every day for 1 month and then think you're good for the rest of your life? Skincare is literally that, taking care of your skin and continuously. So it's something you're supposed to be doing. What might change is what you're using. Like if you had acne, maybe you might stop using the actives so often and reduce
Yeah.
them, but you still need to have some kind of routine.
That's true. I like the fact now that you've talked about timelines. How long should you use a product before you actually declare it's not working for me?
Minimum 1 month,
Okay.
because that's like how long this process of
Turnover.
turnover happens. Like your skin producing new cells coming to the surface and the dead skin shedding. But some products you'll know earlier, like something that's supposed to be hydrating, use it for like even like a couple of days and you're not noticing a difference. Maybe you need to build up more on the hydration. But for acne, sometimes it can take longer, maybe even 3 months.
yeah.
Depending
And
on
hyperpigmentation, right?
hyperpigmentation, we say
longer.
minimum
Minimum 3
to
months.
see some progress,
Okay.
not for it to disappear, and up to a
Yeah.
year
Okay.
for it to completely clear.
Okay.
Yes.
I have some. So I'll just wait for. Let me tell you, it's a funny story. I went for a wedding and then I wore boob tape. Then I think I ripped it off. So I blistered a bit and of course it's left some scars. So I've been using some
What the
products.
hell are you doing?
I honestly I don't know.
Wait, how are you supposed to remove it? Like oil or something?
Slowly. I don't think like I ripped it off like this. I think I was just a bit too aggressive. So it blistered a bit and then it left some dark spots. So I've been trying to like work on it. I've been using what is it called? Like some spot treatments. I don't name the brands.
I think I already
But
mentioned.
yeah, but I'm seeing progress. But now it's good to hear that it can take up to a year for it to actually disappear. Yeah, but the progress is definitely there.
Yeah, but also as people of color, we need to accept hyperpigmentation as a part of our lives.
That's true. That's
so as
true.
soon as you clear this dark spot, there's another one here, another
Yeah,
one there. So
yeah.
it's just a continual journey.
That's and you have to use sunscreen as well. Something I learned.
For any dark spot.
Okay, so I have something else because we've talked a lot about products, but healthy skin doesn't only come from the products you're using. So, Daktari, please, a quick one. What can we do in terms of just our lifestyle to be able to transfer that health to our skin as well?
Yeah.
Yeah.
So sleep, adequate sleep.
And what is
6 to
adequate
8
sleep?
hours. 6 to 8 hours. Your diet, balanced diet.
Now, please, that's always a gray area. We
Balanced
talk about
diet.
diet. Now, people tell you, oh, chocolate does this to my skin, peanut butter. Is that a thing?
So many studies, they'll mention something like skimmed milk. I think, is that low fat?
Yes.
Yeah.
skimmed is low
Skimmed
fat.
milk apparently causes acne more than this whole fat.
Really?
Yeah. Skimmed milk. What else? Wheat, gluten. So yes, I don't brush it off. I think
Okay.
diet does play a role.
Okay.
Yeah. And one thing I'm key on is listen to your body. If you're seeing chocolate has done something, then maybe it has. Yeah, listen to your body, your skin. Just listen to your skin. Even when you're using products, listen to how it's responding to that. So yeah, sleep, diet. I'm not a nutritionist, so I'm not going to tell you. But yeah, your fruits, your veggies, definitely. And also, I mentioned increased sebum as one of the factors. So obviously, if you're taking more oily, fatty foods, not that it's going to be secreted through the skin, but it plays a role in all that.
contributes.
Yeah.
Okay.
Yeah. Then what else? Exercise, definitely get the good hormones flowing.
What about water?
Water. I listened to a podcast,
I
which
thought
I
you're gonna say,
agree.
I listen, I don't judge.
No. No, they're saying water doesn't obviously if you're dehydrated it will show.
Yeah.
But it doesn't directly show that you've been drinking a whole gallon through your skin.
Yes.
Yeah.
Thank you.
It's
I just wanted you to say
it
that.
doesn't. It's not a
Topical
direct.
hydration
Yes,
is
topical
even more
hydration is more
important.
effective than oral.
Okay, okay.
Yes.
And now you mentioned topical hydration. When you have products and it's written for oily to normal, dry to normal, is it true? Like, is that product specifically for oily to normal skin, or is it for?
Um, this is how I like to say it. It's really important to also evaluate the product as a product itself.
Okay.
Because sometimes a brand will indicate for normal to oily skin, but if you actually use the product, you find maybe it's better for dry skin based on the texture, how it actually applies on the skin. Unfortunately, sometimes brands put labeling that's not accurate, like now based on the consumer experience. Okay, yes, they've made it, maybe that was the intention, but when you actually use a product as a consumer, this is how it's functioning on the skin. So that's why it's important to look at reviews. Because just because it says for oily skin doesn't mean okay, this one is for me, I've put it in my basket.
Yeah.
Go and find out, okay, how does this product actually apply? If the store has testers, try the testers. There's a really popular lotion, I won't mention the brand. It's indicated for dry to very dry skin, but that lotion is very lightweight. If you have dry skin, it's not going to feel adequate. And actually, when you come in, we'll tell you the same thing, but you maybe think we're crazy because, but see, what is someone dry skin? But if you use it, that's not the case.
Yeah.
I want to add onto the question about holistically.
Yeah.
Generally, foods that trigger inflammation in your body, it'll also show
On
your
the
face.
skin.
Yeah.
So that's the sugars, dairy, and like certain fats. Some people have an issue with nuts. So yeah, look at your skin and maybe even keep a food diary. If you can't figure out what's causing your skin to break out, and look and see what could possibly be breaking me out. But sugar is a really big one.
Yeah.
And sugar actually causes skin aging, like directly.
Aging.
Yes.
Oh.
Yeah.
Wow. You know,
sugar
me, I'm a
you eat
foodie,
today.
and my foodie is sugar. I eat a lot of sugar.
Yeah, so
Am I
if you
looking
take care
old?
of your body generally, then it will also show on your skin. So I was just saying like diet and exercise. Good fats are very good for your skin as well because your skin doesn't actually produce some of those fats. So like your avocado, your tuna, like omega-3 rich foods are also really good for your skin. Yeah.
I have a point on the normal to dry skin, blah,
Yeah.
blah, blah. So it's also important to know the different vehicles that there are. So lotion, gel, cream. Yeah, so I think that's why, okay, depending on the brand, I would believe it's for normal to dry skin, given the consistency of the product. So for dry skin, the jellies or
Creams.
ointments. Yeah, for oily skin, go for lotions, gels. Yeah. So that's
And
another
especially
thing.
like, okay, let me not call it
Eczema.
eczema. You said we don't use the word eczema, but people with atopic dermatitis,
Yes.
yeah. Because I find people using lotions, and I'm just like, but you
Yeah.
have atopic dermatitis. You need something that will keep the moisture
Yeah.
in.
Yeah, that will add and
Yeah,
occlude.
and
Yes,
seal it.
exactly.
Yeah. Oh, okay. So as we wrap up, I think you guys, I'll have you back because there's so much to talk about skincare. But I just want you, how can people be more conscious in their consumer behavior when it comes to skincare?
I think the first one definitely is research.
Yeah.
And build a routine that is sustainable for you. Just because you've seen Yvonne has come and used a routine for 20K, you go and you fuliza and you're like, this will fix my life. You know how we have that feeling of my skin is good, my life is amazing. But then when they run out, there's no way you can refill this product.
Yes, that's
so make sure
true.
you're picking products that actually fit within a budget that's comfortable for you so that you're able to be consistent. Because again, it's not medicine used for 3 months and then that's it. Some things are not ideal, but like if that's what's within your reach, do it. If you can only do like the Dove cleansing bar to wash do that one. For moisturizer, you can use Nivea Soft, do that one. For sunscreen, like use what you can be able to use consistently, and then aim to like get some better products as you're able to afford financially. Because the minute that you now start trying to go for expensive products, you create this narrative within yourself that skincare is not something that can fit into your life, and like it feels expensive.
That's true.
So every time you buy it, you feel like you're spending your money on something you should not be spending, and then it creates a really negative narrative between yourself and taking care of your skin.
Mental health.
Yeah. I'd say those are like my really big two takeaways: consistency and just do your research before you buy a product.
Thank you. Very, very important ones.
Yeah.
But you mentioned Dove. What is a Dove? Like, I hear it's not a soap.
Yeah, it's a cleansing bar.
Uh-huh.
Yeah. So there's a difference between your bar soaps and cleansing bars, and it comes down to the formulation.
Okay.
So cleansing bars are kind of like your liquid cleanser, kind of, but without water.
Okay.
So there's a difference in the formulation. They usually don't have the synthetic kind of detergents that are in bar soaps. So they're less harsh on the skin compared to now like your regular bar soap. So I feel like Dove is a good option for those who like are trying to keep it on low budget. I think it's like 200 or 250.
Yeah, 290.
Yeah, 290. Before you can be able to move up to a cleanser. And also maybe if you have really sensitive, easy to irritate skin, it's a good option.
Because I use Hazelic soap. Is that also a similar product like Dove?
I need to look at the formulation,
Okay.
but I don't know that I agree with you. Use it every day type of thing.
See her after this.
Why? Nitakona nyuma ya tent. I use it, okay, yeah, mostly every day.
It doesn't feel
But
harsh on your skin.
no, imagine it feels so gentle. And I have sensitive skin.
Yeah.
It feels very gentle.
Interesting, but I think that also brings up another point.
Yeah.
Skin is so different.
That's true.
Right? So also, in as much as there are these rules, it's not like doesn't apply
One
across the
size
board
fits
all the
all.
time.
Yeah.
Exactly. So there's exceptions, and maybe in your case, for example, yeah.
Okay. What about you, Dr. Njeri?
For me, I'll emphasize on listening to your skin. Yeah. Also patience, consistency, and simplicity. Yeah. Yeah.
That's true. Less is more.
Less is
Yeah.
more. And you have the rest of your life, God willing, to try out things. Because I know sometimes in your skincare journey, you also plateau. Like me, I've plateaued. You've used products, they've worked for a while, then you just stop seeing the benefits. So you can always switch it up. But then obviously seek professional advice on how to switch it up. Yeah.
Can I build on simplicity?
Yeah.
Again, just because you see me use 20 products doesn't mean you need 20. One is my job.
Yeah.
But secondly, you can have 3 products in your routine is okay. Yeah, I think that's important. I think TikTok has taught us you must have a whole shelf full of products.
What do they call it? It's consumerism.
Yeah.
Yeah.
Yeah, it is. It's not
Yeah,
a must. You can have
yeah.
an effective routine with just basics.
I like this side of TikTok where people are trying to de-influence people. Have you seen it? Where you
not
don't need to. Yeah, you
I
don't
feel
need
like that
all
also has a
that.
negative implication.
Really?
Yeah.
Okay. All right.
That's true.
Okay. So guys, I think we've talked a lot, and we'll be back definitely. You agree? Yes. Thank you. Thank you.
It's a lot, yeah.
Yeah, it's a lot to
Very
dissect. But I think before my guests leave, I like you to just give us one myth and misconception you'd like to debunk. It doesn't have to be related to skincare.
Okay.
Yeah, but anything you've wanted to say, say.
Oh, black people don't need sunscreen. I thought we left that in like 2015. But the other day I was like on a webinar and someone asked that question. There's an argument that was given.
Yeah.
Like, why do we need sunscreen as adults if babies don't use sunscreen and they're in the sun? Yeah, it hit a big point for sure. So number one, and I think you'll either correct me or validate, you don't need 8 hours to get your vitamin D requirement.
For sure.
Right?
Yeah.
You don't need 8 hours. I think it's about maybe 30-40 minutes. And your skin is unlikely to burn within that time frame. I think people who burn the fastest it'll take maybe is like 20 minutes. And then again, you should protect your skin from the harsh sun, especially that 10 a.m. to 2 p.m. sun. It's the one where you're really trying to protect your skin. And aside from the cosmetic consequences of not wearing sunscreen, there's also the health consequences. The sun actually really depletes your skin's hydration levels. It's not good for your collagen cells. It makes your melanocytes hyperactive. So there's all those health aspects for not using sunscreen aside from the cosmetic. And I know currently right now we're in an era where everyone is a health like guru and whatnot. And sunscreen is one of the things that's being attacked. But it's important to use sunscreen. If anything, at least between those hours. But you can still get your vitamin D in the morning and then apply your sunscreen.
That's morning or evening actually. Yeah. Two what do they call it?
Skin,
fingers.
Two
fingertips,
fingers?
Yeah, the more accurate is half a teaspoon.
Half. Oh wow. Okay. Okay.
For me, I don't know. It's about seeing dark underarms or inner thighs as a flaw. Yeah. So I'm not with the craze of trying to lighten those areas. Like,
Okay.
I mean, yeah, you can use glycolic acid, but just accept we're black.
Yeah.
Yeah. So I'm a bit skeptical about some
Yeah.
beauty standards we're trying to achieve.
Perfectionism.
Yeah.
Okay.
That's it.
I think for me is that you need to use actives in all your products. I think people don't really look at the ingredients of their products. So you find that your cleanser has actives, your moisturizer has actives, your toner has actives, and you're just depleting your skincare barrier. I think you'll correct me if I'm wrong. But you don't need that. I
Need
think
a balance.
Yeah, you need a balance. And actives actually, they damage your skincare barrier. And that is the most important thing to keep your skin healthy. Remember, your skin is not just for beauty. Your skin has, there were 10? There were 10 functions of your skin. So if you damage that barrier, you're actually damaging the normal processes that your body needs to go through. Yeah, so that was it.
Thanks for having me.
Thanks, guys, for coming. Please come again.
Sure.
So, guys, please remember to like, to comment, to subscribe. I'll leave all their details and their handles below so you can interact with them and just get to see more of what they do. I think you've seen that they're very passionate about skincare. And I know Yvonne educates a lot on her page. Dr. Njeri, if she allows me, I'll put where you can find her in the hospital, if she allows me. If she doesn't, itabidi mtafute please on your own. But that's it for today, and see you next time. Bye.